Today in this video we will see the critical care nursing MCQs with rationale for staff nurse exam. First question. Mr. Ramu, carpenter by profession, has come to emergency 1 hour back with severe non-productive cough, difficulty breathing and shortness of breath. He has an allergic history in due to wood dust. Which of the following lung sounds a nurse may expect while auscultating the lungs of Mr. Ramu? A. Ronchi. B. Wheezing. C. Pleural friction rub. D. Stridor. Answer B. Wheezing. Rational. Ramu is experiencing occupational asthma due to inhalation of wood dust in his workplace. In asthma, while auscultating lung, nurse expects wheezing sound. A. Ronchi. Ronchi means low-pitched sound heard during both inspiration and expiration. B. Wheezing. Wheezing is a high-pitched musical sound heard during expiration. It is a peculiar feature in asthma. C. Pleural friction rub. It is a cracking sound heard during auscultation in pleural damage patients. D. Stridor. It is a high-pitched sound but volume is less comparing to wheezing and it is heard mostly during inspiration and it is seen in upper airway obstruction patients. Second question. The vital signs of a 30-year-old patient are pulse 110 per minute, respiratory rate 26 per minute, SpO2 94%. What priority action the nurse should take to manage this patient in emergency? A. Deep breathing and coughing exercise. B. Give sedation. C. Intubate the patient. D. Nebulize the patient. Answer option D. Nebulize the patient. Rational. The increased heart rate and decreased saturation shows patient is having respiratory disorder. Respiratory disorder means he is having obstructed or narrowed airways. In this condition, the nurse priority action is to dilate the airways by nebulizing the patient. Then the condition will improve. Third question. A 45-year-old woman is admitted with generalized edema and suspected heart failure. The nurse expects which of the following diagnostic tests to be ordered by the physician in addition to standard blood test? A. D dimer. B. Serum ferritin. C. Serum albumin. D. Serum brain natriuretic peptide level. Answer option D. Serum brain natriuretic peptide. Rational. BNP test measures the serum brain natriuretic peptide level in the blood. It is a protein made by heart and blood vessel. In case of heart failure, the heart cannot pump the blood, so the BNP levels are higher than the normal. Option B. Serum ferritin. It is a blood test detects the amount of stored iron in our body. If serum ferritin level is low, then it indicates iron deficiency anemia. C. Serum albumin test. It is a blood test used for diagnosis of liver disease and kidney disease. Fourth question. The percentage of water in human body is A. 60%, B. 80%, C. 70%, D. 35%. Answer is option A. 60%. The percentage of water in human body is 60%. Fifth question. Nurse Ramya is caring for a patient who is in anaphylactic shock. While checking the prescription order, before administering medication, she found an inappropriate drug is ordered and asked for an order clarification from the treating doctor. Which of the following drugs is most likely inappropriate drug for this patient? A. Adrenaline. B. Corticosteroid. C. IV furosemide. D. Isotonic IV fluids. Answer Option C, IV furosemide. Furosemide is also known as Lasix. Rationale. In anaphylactic shock, patient needs fluid because shock is a condition in which there will be decreased blood volume, and in anaphylactic shock it occurs during allergic condition. If if we give the furosemide to this patient, it will aggravate the condition because the action of furosemide is to remove the extra fluid from the blood. It is a loop diuretic, so it is contraindicated for this patient. Other medications like adrenaline and corticosteroids are used to treat allergic condition, and isotonic IV fluids is used to treat the shock. So we have to check the prescription order before administering medication, and if we found any inappropriate drug ordered, we have to ask for a doubt from the treating doctor for clarification. It will prevent the administration of wrong medication to the patients. Sixth question. Nurse Ramya, a palliative care nurse, is providing nursing care to a terminally ill patient during dying and grieving process. She is aware that the least important goal of nursing intervention in this client is A. Providing comfort measures, B. Promotion of rest and sleep, C. Increase self-esteem through cosmetic improvement, D. Pain management. Answer option C, increase self-esteem through cosmetic improvement. From this question, we understand that the patient already know that he or she is going to die soon. In palliative care, nursing intervention should target pain management by providing comfort measures, promotion of sleep and rest, and pain reduction techniques like analgesia. So option C is the least important goal for this patient, and it is the correct answer. Seventh question. Mr. Ruma, a 27-year-old, has fever and pain in the right upper quadrant that increases on eating fatty food and anorexia. She is recently diagnosed with cholelithiasis on abdominal ultrasound. The nurse explains to the patient which food she should avoid taking is A. Potato, B. Rice, C. Bread, D. Cheese. Answer option D. Cheese. Normally, the gallbladder is an organ in which the bile is stored and it is used in the fat digestion process. Cholelithiasis is a condition in which gallstone occurs, so there is a disruption in the fat digestion process. If these cholelithiasis patients, if they take food with high fat content such as dairy products like butter and cheese and fried fruits, it will worsen the condition. Other foods in the above options are appropriate to consume. Eighth question. Regulation of pH within the body is done by A. Spleen, B. Liver, C. Heart, D. Kidney. Answer kidney. Option D. Rational. Kidneys control acid-base balance or regulating the pH of blood by excreting hydrogen ions and generating bicarbonate. Normal pH of blood is 7.35 to 7.45. So kidney is the major organ, regulates the pH. Ninth question. A 42-year-old woman with CA breast underwent mastectomy. A Jackson Pratt drain is placed to help empty excess fluid from the wound site. After emptying a Jackson Pratt bulb, the nurse needs to re-establish the negative pressure in the system. Which of the following actions is required to re-establish the negative pressure? A. Place the bulb lower than chest level. B. Fill the bulb with normal saline. C. Compress the bulb and open the valve. D. Compress the bulb and close the valve. Answer option D. Compress the bulb and close the valve. Rational. A JP drain. JP means Jackson Pratt drain is a closed suction medical device that is commonly used as a postoperative drain for collecting the body fluids from surgical sites. This is the picture of JP drain. The drain has a soft plastic bulb with a valve attached to it. The drainage end of the tube is placed into a surgical site through a small opening near the incision. A suture will hold it in place. The rest of tube is extended outside with the bulb. When the bulb is compressed with the valve closed, the constant gentle suction or negative pressure is created. The bulb should be compressed at all times except when the drainage being emptied. The bulb is compressed with the valve closed. There will be a constant gentle suction, so there is a proper drainage. The bulb should always be compressed. Only during emptying the drainage, the bulb compression is released. 10th question. It is easy for you. Which complication of IV infusion can cause pulmonary edema? A. Infiltration. B. Circulatory overload. C. Infection. D. Pyrogenic reactions. Answer option B. Circulatory overload. The circulatory overload cause pulmonary edema. It is the complication of IV infusion. If we give patient IV fluids more than the normal requirement, he or she can develop circulatory overload and it will lead to pulmonary edema, a worse condition. It is one of the worst complication. Circulatory overload is the worst complication of IV infusion. Thank you for watching. Subscribe my channel for more videos.